Good afternoon, or to some of you, good morning. Thank you so much for your support as I come in to take on the role of CMA president. I'm fortunate that I'll be working alongside Dr. Ross, who has, as we just heard, a depth of knowledge in the healthcare system that I can only hope to learn from. Bonjour à tous et à tous. Je suis très heureuse d'être à mon tour président de la AMC. Je partagerai mes responsabilités pendant 3 mois en co-présidence avec Dr. Ross. As Dr. Ross and Dr. Lafontaine have shared with me many times, the biggest reward in this role is the opportunity to meet so many colleagues across the country. And I'm really looking forward to hearing your perspectives and your experience and your expertise about what is important to you and what is going on in the workplaces and with your patients. My goal is to improve health and healthcare, and so I know that you share that same aspiration. And this area of advocacy is deeply rooted in why I chose medicine in the first place. It really was to help make the world a better place. And why I chose to get involved with the CMA was to lend my support to building a better medical culture, creating a future of health where everyone, whether it's the physicians, the medical learners, the patients, are fully supported. I feel very lucky to come from public health, where, as cheesy as it sounds, I always believed that the job was truly to try to make the world a better place. The public health physician's job is to look at their community and identify where the challenges are, and then come up with solutions for those challenges. And I feel like the CMA is a similar opportunity to identify challenges and work for solutions at a national scale. During the pandemic, my work as the medical lead and official spokesperson of our vaccine task force in Manitoba, as well as my work as the chief medical officer over the last few years in Winnipeg, has involved speaking up for change. I've worked in government, I've worked in healthcare administration, I've had daily interactions with politicians, with decision makers, with media. I also still work as a hospitalist at Women's Hospital in Winnipeg. And in all of these roles, I've had different perspectives and knowledge gained about different parts of our system. But even more importantly, I've seen my colleagues struggle to wade through a system that doesn't support them to provide the care that their patients deserve. J'ai hâte d'utiliser cette expérience pour être la voix des médecins et apporter les changements dont les médecins ont besoin. I also like to remind myself that we are the author of our own lives, and that means that it's important that we all take the opportunities to advocate at multiple levels. We want to see change, and we need to all be part of that solution. As a physician community, we can work together to make fundamental changes to medicine and healthcare in this country. And as you just heard from my colleagues here, we have been making a difference. Our healthcare system is in crisis across the country. We're seeing daily headlines about colleagues who are leaving practice, experiencing burnout, or barely holding on because of the intense pressure that they're under. And the topic of burnout is deeply personal to me. When I was a resident, I experienced burnout. And while I had support to make the changes I needed to be able to continue in my career, that experience was also extremely traumatic. And I don't want any other physicians to ever have to feel the way I felt when I went through burnout. And that means not only supporting physicians who are experiencing burnout, but even more importantly, preventing burnout by shaping our systems to better support physicians so that they can thrive in their workplaces. Building on the work already underway by the CMA, I look forward to lending my voice and my experience to improve health workforce planning and support the well-being of practicing physicians. And that includes, as I was pleasantly, not surprised, but was happy to hear 2 questions about team-based care. In my career, I spent several years working in a clinic where I was a lone physician, but then moved to a clinic where we had a dietitian, OT, PT, social work, nurse, pharmacist, and I can tell you that there was no comparison between the 2 experiences. As a physician, it was so much better to be working with other experts to feel supported so that I didn't have to be everything to every patient. But for my patients, it was even more important because they could spend time with the pharmacist to review their medications and come up with a daily regimen that worked for them. Or they could meet with the dietitian to spend the time going deep into their dietary needs to have a low-cost approach to their diabetes. or to meet with our OT and PT to do training on hip strengthening exercises when they were having joint pain in pregnancy. Aussi, je suis impatient de mettre à profit mon expérience pour contribuer à la lutte contre la désinformation en matière de santé et ses effets désastreux sur la santé de la population canadienne. So during the pandemic, I learned the importance of building trust, particularly as I was a spokesperson. And in a time where misinformation about COVID vaccines were widespread, that trust was critical. And as we've all seen every day, health misinformation, not just about vaccines, continues to be an important issue. And thankfully, the CMA is helping to tackle that on a number of fronts that I'm excited to join them with. They've been surveying Canadians about how Canadians access health information and what sources they trust. They're funding quality health journalism through a partnership with the Canadian Press, and supporting a network of physician advocates and experts who share credible health system information and news directly with Canadians. As Dr. Ross, Dr. Strasberg, and Mr. Smith have laid out, I also look forward to building on the CMA's ongoing work around climate change and health, as well as our apology to Indigenous peoples and the public-private discussion, with a focus on equitable access to care for Canadians. And all of this still on the base of a safe and healthy work environment for physicians. These are bold, big issues that will take bold, big action to address. And I want to be part of the solution to these challenges together with all of you. As individuals, our impact would be a drop in the bucket, but together we are a force. Si on agit seul, notre impact peut être limité. Mais ensemble, nous pouvons faire beaucoup plus. I continue to be inspired every day as I see your dedication in providing exceptional care and developing creative solutions to the problems that we face. And I look forward to meeting as many of you as I possibly can over this next year across the country to grow our collective impact, to learn from all of you, and together make the world of medicine a better place. So today I thank you, merci beaucoup, and miigwech.